everybody. So this is the first video in quite a few years that I've done some YouTube videos for my class. I decided this term that I was going to make a supplemental video for a couple of the lectures that I don't have supplemental videos for. Sorry, I'm trying to move my screen so my image isn't so weird. So one of those is going to be for anatomical terminology here. So I am going to go over some anatomical terminology so that you all have a little bit more of a basis. Normally, this is what is done in lab on the first day of lab, but I just wanted to give you it's just a little bit extra information in case you needed some extra help. So what I'm going to do is I'm going to go over probably body positions, how to use directional terms correctly, and like very, very brief information about regional terms in hopefully the first part of this video. And then the next part of the video, I'll go over the remaining portions, the planes and the sections and internal organization of the human body. That usually is it's a little bit of a bigger chunk that needs a bit more explanation, especially the internal organization. So we're going to get started. Okay, so to get started here, well, yeah, sure. Let's use red, might as well. I'm going to go over the three basic body positions that you really want to know. So the first body position is over here. It is called standard anatomical position, or if you want to, you can say SAP for short. There are a couple key things that you want to know about standard anatomical position. It is the position that all anatomists use, and we primarily refer to the human body in that position. So when you look at your textbook and you see pictures, it is going to be of a patient or a subject in this body position. What that means is they are standing, they are facing you as the viewer. So that tells me that the face and the front of the body, that's all the anterior surface of the body. Legs should be straight, pointing forward. And then one of the most important key concepts is here is that the arms need to be to the sides and the palms need to be in the forward direction. Okay, not out, not up, not backwards, because what that tells me is this is the front, and what we call the front is actually the anterior. You can also call it ventral side of the body. So that's a very important concept because that means this whole side of the arm is on the anterior or ventral side. And that becomes very important, especially when we get to some of the muscles in the forearm, because the ones on the anterior side do specific things, the ones on the posterior side do other things in terms of actions. Then you have two reclining positions. One is called supine, and the other one is the prone position. Supine and prone are very important, especially when you're thinking about your future in healthcare. Most of the time, your patient will not be standing. They will probably either be sitting or they will be laying down. And then you need to start to also think about, well, in the laying down positions, how is the body positioned so that we can reference one body part to another part? In a supine position, what you want to see is how the spine, which would be like right there, is down. And then we see how the face is actually pointing up. Now, I know here they are showing that the palms are actually downwards, and then in this case, the palms are facing upwards. I think that's just because when you lay down, it's not that convenient to have your palms facing upwards, especially if you're in a supine position. Really, if you're in a prone position, that it just seems unnatural. But you should think about that. Yes, this is almost like standard anatomical position is. It's just that you're reclining. In a prone position, what you want to see is you see how the spine is actually in the face up position and the head is actually faced in the downward position. here the head is actually tilted to the side because, again, that's not a very convenient position when you're in a laying position for your face to be face down. So unless you have like a pillow where your head goes through it, you'd have to tilt your head one way or the other way. So those are our important three positions we want to think about. So the next thing is understanding what we call directional terms. Okay, so this is what directional terms are. What directional terms are going to do is exactly what their name says. They're going to help you determine direction. How do you get from one place in the body to another place in the body? I can use right, left, up, down, forward, backwards, but instead, anatomists have given specific terms for those directions. In this case, you don't want to just memorize the definition. The definition is not going to help you. What is going to help you is how to use this word correctly. It's no different than learning a foreign language. If you're an speaker trying to learn Spanish, if you're a Spanish speaker trying to learn English, the definitions of the words are not the most helpful thing. What is most helpful is understanding how to use that word properly in a sentence. So that's what you want to think about here. Most of these terms are pretty straightforward, but utilizing them to go from one place in the body to another place in the body can sometimes be a little bit challenging. So you have to think it through, and I'll show you guys some examples. Then I would say try to use the normal everyday word and then switch it out with the anatomy word, especially if you only memorize definitions, you're going to have to take a couple extra steps to figure out what is the most correct word. So each of our directional terms tells us a direction that we are going to move in the body. And the body is, three-dimensional, so you can move in different, essentially, planes. That means each of our directional terms has to have a set of like terms that are paired and they're opposite, just like right and left, north and south, east and west. You'll see that with these terms too. So we're going to start kind of maybe like over here with our terms and work our way, whoops, to maybe some of the more difficult ones. Okay, cool. So I'm going to start right about here. So our first two terms, they are called anterior and they are called posterior. So you can have an anterior surface, like this is my anterior surface, which means back behind me is my posterior surface. But if you're not talking about the surface, you're talking about a direction, then that means you're going to go from the back here to the front in the anterior direction. The opposite is true too. If you go from the front to the back surface, that is the posterior direction. So how you can use these terms is kind of simple. Like in this picture over here, we see that this is the sternum right here. This is usually one of my go-to sentences. And what you will think about is the fact that the sternum is in front of the heart. And you can't really see it very well, but you see how they've labeled the heart right there. Okay. So I can say the sternum is anterior to the heart. And then I can say the heart is posterior to the sternum. You have to think about it as the sternum is right here, and then the heart is back behind that. So you see how I have to go in the forward direction to get to the sternum. And then I would have to go in the backwards direction to get to the heart. Because humans are bipedal, meaning we stand on two legs, our anterior surface, which is technically our face, and our posterior surface, which is technically where our gluteal area is, are on the same surfaces as where our belly is and our back. The belly is known as ventral, the ventral surface. I won't do that because I'm too low there. The back is technically called the dorsal surface. So when you go in the forward direction, you are also going ventral. And when you are going backwards, you are also going dorsal. This is a bit different if you're not a bipedal organism. And I'll show you that in another picture. But for humans, we can use anterior and ventral interchangeably, and we can use posterior and dorsal interchangeably. All right, so that's the first ones. Okay, let's go over here. Let's do some easier ones also. So let's do number 2 right here, which is superior and inferior. Superior is very simple and straightforward. You are going to a higher position in the body. So you can say things like the head is superior. You don't have to reference it to something, but you could. You could say the head is superior to the toes. Then you can say going towards the bottom part of the body is inferior. So we can say things like the toes are inferior to the head, or we can just say the toes are inferior. So you do have to be a bit careful here because superior and inferior primarily are going to refer to the main body or the torso area. You should never use superior and inferior when you're referring to things that are connected together. For example, the digestive system, for example, the arms and the legs, because they are connected together and they can move positions, superior and inferior are not the best terms. Like I would not say the fingers are inferior because as soon as I raise my hands up, now my fingers are superior. So I have to use a different term there. Here you can see there's another term, cranial or caudal, again, because our head, which is cranial, and our tail here, which is caudal, are in the superior and inferior directions. You can say the head is cranial to the feet. Or you can say the feet are caudal to the head. Lots of times, cranial and caudal are maybe used more for what is called a quadruped or for our embryo. So just make sure you understand like cranial just means towards the head end, caudal means towards the tail end. That's number 2. Okay, number 3 is right about here. We're going to look at medial and lateral. And medial and lateral to me are not that difficult, but what gets you is you look at this picture and you think medial and midline are the same terms. The midline is the middle line that is going through the body. It's an imaginary line. It is not a directional term. It's just an imaginary line. But when I go from an outside so from like an outside part of my body towards the midline, I am going in the medial direction. When I'm going from the midline out, sorry about that, that is the lateral position. So that's what you want to think about. When I'm going towards the middle, that's medial. When I'm going out away from the middle, that is lateral. So again, I can use like my sternum here. My sternum is medial. It's in the middle. It's towards the midline. I can say my arms are lateral because my arms are off to the sides. They are lateral to my torso. You see how those sentences work because you're going in this direction, back and forth. So now a little bit of the harder ones. Okay, so then we're going to go to proximal and distal. And proximal and distal have eluded students for years. It's sometimes the more difficult ones until you explain it in more detail. So proximal means closer to an attachment point, and distal means farther away from an attachment point. So you should only use proximal and distal in a couple of situations. One is for your appendages, for arms or legs. If you have something connected in a tube, then you also use proximal and distal. So I wouldn't say my head is proximal to my feet. I wouldn't say my feet are distal to my head because I have better terms, and those better terms are superior and inferior. So you want to see how if we're at a distal part and we're moving towards the body attachment here, that is in the proximal direction. Or better yet, if I'm at the body attachment right about here and I'm moving away from that, that is distal. So sorry about my really weird proximal arrow. Like I said, it's been a while since I've used my little pen pad here and done a video. So it's going to take some getting used to again. So things you can do. You can say the shoulder is proximal, the fingers are distal. And then it doesn't matter. Even if you raise your hands up, the shoulders are still the first attachment point and the fingers are still the last attachment point. That's why you use proximal and distal. Another one is that we use proximal and distal for the digestive system. There is something that is closer to an attachment, and there is something that's farther away from attachment because that is a tube that is all connected together. You can use that for blood vessels potentially because they are either closer to the heart or they are farther away from the heart. Therefore, you would use proximal or distal. When you get to the skeletal system, you will see the phalanges here also use proximal and distal. This first phalange is proximal, then you have a middle one, and then you have a distal one. Proximal, middle, distal. So this is why it's very important. You'll use this in the skeletal system quite a bit because you have things connected together. So even for the leg, you're going up, that is proximal. You're going down, that is distal. So often what students get most confused on is when you get to the leg, you think you should use superior, inferior, but go backwards to your prone patient here or your supine patient. How can I use superior and inferior, which is in this directional plane, if I'm laying down? I really kind of can't, but I might still have to reference the leg. So that's why I'm going to use proximal here and I'm going to use distal there, and it still helps inform that person you're working with what you're talking about. Okay, number 5 is over here. We're going to do superficial and deep, and there might be a couple extra ones on your lab manual or on the PowerPoint, like contralateral and ipsilateral. Those we don't talk about too much. We'll talk about contralateral later when we get to the nervous system, but we're just going to kind of do some basic terms here in the beginning. So the next one is superficial and deep. And actually, superficial and deep has been the one that in the last couple of years eludes many students. And it's a weird thing to explain superficial and deep because superficial and deep require a layering system. So it's mostly going to be used for a tissue layering system. Think about your skin is a tissue on the outside surface. Your skin is superficial. You see how if we're going in this direction, sorry, my color's the same. If I go towards the surface, it's superficial. And then when I go away from the excuse me, when I go away from the surface, that is deep. You notice how deep is all the way around and superficial is all the way around. The best way I like to explain superficial and deep is that I like for students to understand it is a layering system. So oftentimes I like to use like cake as my example. Frosting is superficial because it should go all the way around the cake. And then the cake is deep to the frosting because it is completely surrounded. If you use it this way, then you will not use superficial and deep incorrectly. Oftentimes it becomes like, should I use superficial and deep or should I use anterior and posterior? And in my opinion, you should think about which is the better term. If something is in front of, you use anterior. If something's in back of, you use posterior. If something is going all the way around, that's superficial. If something is underneath, something that goes all the way around, that is deep. Like when we come over here and we look at how the ribs and the lungs are situated, the ribs actually go all the way to the back surface. So they go all the way posterior. So that means they go all the way around the lungs, which means they have to be superficial to the lungs, and the lungs have to be deep to the ribs. Sometimes people will say like the sternum is superficial to the heart. Kind of, that is correct because the sternum is more on the surface and the heart is deeper to the surface. But because the sternum doesn't completely encase the heart, I would use anterior instead. I think that's a better term. And this is where you have to be mindful a bit of what do you think is the better term? Like stick something in there and stick something else in your sentence. And if there's a better term, then you might have to swap them out. So I have a couple of examples here. I already did some of these, but I want you to understand that when we do this, we're using this language. We're not memorizing this language. It's not about memorizing the definition. I won't ask you what is the definition of superficial. I'm going to ask you maybe in a like a blank situation like this, excuse me, a fill in the blank situation like this, where I would ask you to fill in these blanks with the correct directional term. So we already see we have the heart is blank to the sternum. Sometimes you guys write deep, but this should be posterior. Remember, the heart is back behind sternum. I've seen students use medial or lateral because you already know that the heart is not exactly at the midline, but I mean, the sternum pretty much covers the heart at the midline and the heart's still at the midline, so don't overcomplicate it. You want to think about if your sentence makes sense. Is the heart outside to the sternum or is the heart towards the midline of the sternum? That doesn't exactly make sense. But saying the heart is behind the sternum, it clicks into place and you understand where those two structures are. Okay, so let's do this one at the top. It usually is the one that confuses a lot of students when they look at the lab manual, when they're doing their lab. The ears are blank and blank to the shoulders. What this means is you have two directional terms that are going to help you identify where the ears are in location to the shoulders. These sentences are oddly phrased. You probably would not say this in a normal clinical setting, but this is how they have to be phrased in order for us to understand how directional terms really work. So there's two directions. Okay, so one, if you kind of start at your shoulders here, that's your starting point. Then you can say, well, what direction do I have to go to get to my ears? Well, I have to go up. So the ears are up or superior to the shoulders. But then when I go up, I don't hit the ears. And oftentimes I tell students, well, just draw yourself a little picture here, right? Oh, wow, that's a terrible picture. I really do need to work on my skills here because they have gotten really rusty. I'm much better on the whiteboard. So you see how your shoulder should be a little bit bigger like that. You go superior and then you don't hit your ear. You have to go in that direction towards the midline. And if you don't believe me, like that, then I have to go like that. So it should be superior and medial to the shoulders. Then you'll hit the ears. All right, so this last one is the elbows blank to the fingers, but blank to the shoulder. And you might want to go back and look at this picture to help you with this because the elbow is right in the middle. And this is often a more difficult sentence because since the elbow is right in the middle, you're not sure if it's proximal or distal. Well, it's proximal to some things and distal to other things. It depends on what you're referencing. And you have to think about how your sentence is phrased. The elbow is blank to the fingers, right? The elbow is blank to the fingers. So we start at the fingers and we go up to the elbow. And we see that is proximal. So the elbow is closer than the fingers. Since the elbow is closer, this has to be proximal. but blank to the shoulder. So we go back here. We say we start at the shoulder and we go that direction. That's distal. Sorry about my arrow there. So we see that we can go in the distal direction, right? The shoulder is, or I'm sorry, the elbow is distal to the shoulders. The shoulder comes first and then the elbow. So the elbow is farther than the shoulder. So that has to be distal. This is one of the ways that you can think about how to do these fill in the blanks is you have to think about what it would be the normal word and then swap it out with the anatomical word. So you want to work on that. Okay, work on that using many of the fill in the blanks that you have in your lab manual. There are quite a few of them. Some of them are very complicated, which is on purpose to get you thinking about these terms in a little bit more detail. So as I said in the beginning, some of the terms for a quadruped are slightly different. And that is because a quadruped is an animal that's on four legs. And since we have a dog here on four legs, we have to understand that, I mean, this is their anterior surface right here. That's where the face is, where their glutes is going to be their posterior surface. So you see how it says, oh, we're going cranial or we're going caudal, because you're going either to the head or you're going towards the tail. This is also going to be anterior, though. Anterior, and this is also going to be posterior. So you see how the quadruped changes slightly from the human. And if you don't believe me, you see how it says now that the back of the dog is the dorsal surface and the belly of the dog is the ventral surface. So when you're going towards the back, that's dorsal. When you're going towards the belly, that's now ventral. You can't use anterior and posterior in that sense. This is just to help you make sure that you understand when you get your dissection specimens in class, you have to lay them on their dorsal surface or their ventral surface. It's also to help you think about this in terms of an embryo. When we do embryology, your embryo kind of looks like an alien, and this is where its head end is, this is where its tail end is, this is its dorsal surface, this is its ventral surface. Then you have cranial, and there you have caudal. So we will use those terms for the embryo, so just be aware of those, okay? Excuse me. Okay, last thing here for this part of the video, so it's not too long, so you guys don't get bored, is that the body is going to be divided up into regions to make it easier for us to talk about those regions, but also study those regions. So you do need to know these regions. It is very important that you learn these regions from day one and you keep actively like engaging yourself to remember these regions. They will help you in many cases throughout this course because most of the structures in these regions are named after the region. And I'll show you some examples. So to start with, there are two major regions. One is called axial. Okay, axial is right down the middle of the body. It is the axis of the body. You see how it has cranial, cephalic, thoracic, abdominal, and pelvic. So cranial is the head. This is cranial. And that would include the posterior side. That's cranial. Cervical is the neck portion. And that will become important when we get to the skeletal system. The bones right here are called the cervical vertebrae. It goes along with the fact you're in the cervical region. Then you have thoracic. The chest is now not called the chest, it is called thoracic. And then thoracic is further subdivided. As you can see, there are many different colors here to help you see that thoracic gets divided into smaller regions. Then you have abdominal here. And this triangular area, excuse me, is called pelvic. So these regions then get, like I said, they get further subdivided. You can have inguinal, and if I erase this, what you'll see is pelvic is really right here. So I should actually really relabel that. This is pelvic. And then these little triangles on the sides where the leg meets pelvic, this is called inguinal. It's like where the body ends, the torso ends, and the leg begins. Then you do have pubic. Pubic is where the genitalia are, the external genitalia. So that you can see that you have further subdivisions. Even on the back surface, or on the dorsal surface, we should say, posterior surface. Excuse me. This here in yellow is thoracic, but then you also have a smaller region right here that is called scapular. It's called scapular because that's where the bone is. That's where the scapula is. And this is where spelling becomes very important. If you write scapula instead of scapular, one is a bone and one is a region. Well, this part right here is considered abdominal. It is the posterior abdominal region. It has also got a specific region along the midline, and that is called lumbar. Then you see things like gluteal. I mean, everybody knows gluteal probably. And a triangular area, which is going to be sacral. So like I said, sometimes these refer to the underlying structures, including the bones or the muscles or the blood vessels. Then the next larger parts are appendicular. Appendicular are the arms and the legs. So we got arms, and I'll just do over here, we have legs. The arms and legs are broken into many regions. Most of those regions are the same on the anterior surface and the posterior surface, but there can be some slight variations. Here we have brachial. And brachial is very important. This is where your brachial artery and vein are located, where you do blood pressure from. Excuse me. Where your elbow creases, this is called antecubital. But then on the back, this is called olecranal. So you see some slight differences between anterior and posterior regions. The same is also true on the leg. On the anterior, this is called patellar. On the posterior, this is called popliteal. And popliteal is really important because there's actually a blood vessel that runs right there. It's called the popliteal artery and vein. So even if you think that these aren't going to be useful for you this semester, they will be useful in the next semester once you start learning blood vessel names. I mean, even this little armpit area, which is called axillary, is where a blood vessel runs. It's called the axillary artery and vein. So will become handy to learn these now and then continue to like integrate that information as you progress through class. You don't just memorize this for a test and then you data dump it. It's meant to help you progress through this class continuously so you don't have to keep relearning stuff over and over and over again. You add to your knowledge instead. Okay, so it's your guys' job to go through every single one of those individual smaller regions and make sure you know them. You don't have to know the underlying structures, but you do have to know those regions. They will be on tests, they will be on practicals. They come in handy when you get to excuse me, when you get to muscles, when you get to bones.